Good day, my dear friends. Welcome back in Is and Different Radiology. Today, our appointment with the interesting radiology cases, Group 4, with 5 practical cases. So let's get started. The learning objectives, as usual, in this group of presentations, I provide the case and mention without mentioning any type of examinations or MRI sequence to give you a step more for challenging. And then give 10 seconds every case. After that, I discuss it in that presentations and the explanations, the cause and the finding in the film. After that, the answer. This will be done with all cases, all 5 cases today presented. Case 1. A 53-year-old woman presented with occipital trauma and galaxocoma was 3. Actually, this is a case which remained from the previous group in the previous week. I gave it as an image without answers for more challenging. Today, I will discuss it with you. After 10 seconds, you can think about the case and the presentation, clinical presentations. After that, I will go to discuss it. First of all, what is this type of examinations? This is an scintigraphy or isotopic examination with technetium 99M HMPAO for cerebral scintigraphy scanning. What is the findings we can see in this image? This is the head and this is the tracer uptake, which is not taken at all in the internal cerebral artery territories. However, it taken in the external cerebral artery. Let's go to the next slides for discussion. Technetium 99M is one tracer from the isotopic medical imaging. HMPAO meaning hexa methyl propylene amine oxime, and this is the tracers which is taken by the cerebral vessel. The keywords here, this sign is called when the tracer is taken to the external carotid artery only and not taken at all in the internal carotid artery. This sign is called the hot nose sign. Hot nose signs meaning like this, the regions of the nose, which appearing increasing uptake of the tracer, and the lateral view appearing here. However, in the anteroposterior view, it appears like hot nose sign, which meaning there are tracer uptake in the external carotid artery and not taken by the internal carotid artery. Sometimes this sign is called the empty light bulb signs, referring to these regions which appearing empty from the light or from the tracer uptake, like this empty light bulb. So it is called the empty light bulb sign. These signs referred to abnormal uptake or non-uptake of the internal carotid artery vessels, which meaning death of the brain, to ensure the potential availability of organ for transplantation. So the final diagnosing of this anteroposterior and the both lateral view of technetium 99M HMPAO, final diagnosis here is brain death. Case number 2. This is also the case which I introduced the image in the previous presentations and gave you a chance to thinking about the diagnosis. This lady is 48 years, presented with breast pain and have history of the breast surgery 10 years ago. And this is an MRI image for the breast. After 10 seconds I will discuss it with you. Assuming this is an MRI image, so the subcutaneous fats appeared bright and some cysts here appeared bright also. So this referring to the T2 sequence. So T2 MRI sequence of the both breasts, this is the type of examination. And what is the abnormality here? We can see this silicone or saline implanted in the both breasts, and the abnormality here in this capsule. This capsule, outer capsule, and these inner layers of irregularity in the subcapsular regions, referring to an abnormality in the an implant. So we'll discuss it in the next slides. As we see here, this is another patient with breast MRI and have also silicone implant, breast implant, and the black line here referring to the fibrous capsule, which is normally formed due to a reaction to the silicone when implanted. This is normal one. However, abnormally there are another lines which appearing here as the subcapsular regions of this fibrous capsule, and these lines which appearing also here multiple and irregular line. The key points here is there are two types of rupture of this silicone implant. The first one is the extracapsular, if the capsule is ruptured and the silicone or saline is extruded outside in the breast or in the axillary regions or lymph nodes. So at that time I called it as extracapsular implant rupture, if the silicone in the breast tissue or lymph nodes. However, the most common and the most challenging one in the MRI imaging is the intracapsular rupture of the implant. The intracapsular rupture to diagnosed, there are a lot of signs. The first one in the early stages is the subcapsular line sign. If there are only subcapsular line like this one in the purple arrow, subcapsular lines is referring to an early signs of intracapsular rupture. If these lines become more irregular and more tortuous like this, so it is called the linguine sign. Linguine signs referring to this irregularity and multiple parallel lines which are appearing here also in that breast, and this is which is called linguine sign referring to intracapsular implant rupture. Another sign like teardrop sign can be described also this abnormality, like these regions which can be looks like teardrop, or this region. The keyhole sign, also another word which can be described it, which appearing like this keyhole sign. So it is called keyhole, or this one keyhole also. So keyhole sign, another description for intracapsular implant rupture in MRI. The nose sign like this nose also can be described, as we can see here also this one looks like this nose, or this one, which looks like a nose sign. So all these signs can be described the intracapsular rupture of the breast implant. Another sign which is non-specific sign, when you see some fluid or saline signal within the silicone implant like this is an early sign for intracapsular implant rupture. However, this sign is non-specific. This sign is called salad oil sign. So to be familiar with all these descriptions or these signs, when you hear it at any situations, you can describe it as a sign for the intracapsular breast implant rupture. The breast implant rupture can be intracapsular or extracapsular, as I mentioned already in the previous slides. In MRI, it appeared like this, intracapsular implant rupture, and in the extracapsular one, if the silicone are extruded outside the implant in the breast tissue like this case. However, in ultrasound, the intracapsular appeared as a steep ladder sign like this one, or as a snowstorm sign like this one. So this is the description of the intracapsular and extracapsular rupture by ultrasound. At the end, this is the first image. I introduced it as case number 2, and the final diagnosis of this case is there are linguine signs, keyhole sign, and teardrop sign, a lot of signs here, nose sign also. All of these signs and this subcapsular line, all these signs are representing an intracapsular breast implant rupture bilaterally. Case 3. Nine-month-old boy presented with vomiting and rectal bleeding. And this is the 2 image which was done to him to describe it and to mention the type of examinations within 10 seconds. Actually, this is an barium enema study, as we see the contrast in the colon. So this is an barium enema study. And this one as an ultrasound with Doppler box of the abdomen, which is showing this pathology. So what is the pathology in this situation? If you find this appearance of target sign in the ultrasound, this with a patient or baby boys presented with bleeding per rectum or vomiting or abdominal discomfort, this sign is called the pseudo-kidney sign. Sometimes it's called a crescent in donut sign or target sign. All these signs is descriptions of these lesions in the ultrasound, and in the barium there are filling defect which appearing as a region of ascending colon here. This is the transverse colon and this is ascending colon, and there are multiple filling defect which appeared here. And also in this image we can see the filling defect which introduced until the transverse colon, and this one represented bowel within bowel configuration. All these findings together, when find it in ultrasound as target sign or in the barium enema as a bowel within bowel configuration, representing an intussusception. So the final diagnosis of this target sign or pseudo-kidney sign or crescent within donut sign, bowel within bowel configuration in barium enema, representing a diagnosis of ileocolic intussusception due to intussusception of the ileal loops, which is called intussusceptum, within the colon distal component, which is called intussuscipient. So the process itself is called intussusception and represented by ileocolic intussusception. Case 4. "57-year-old man, heavy smoker, admitted with angina." And this image are taken to him 10 seconds, and I describe it and mention also the type of examination. These are the images of the cardiac images by MRI, as patients are presented with angina also, so you can suspect this is an MRI cardiac. This is the heart and this is the left ventricle, and this is called short axis view of the cardiac image. If you look at this image, you can see the fluid blood in the left ventricle and in the stomach, which appearing bright. So this is without contrast. Short axis non-contrast study. However, this one, there are contrast noted here, enhancing the wool here. So this is a contrast study after 15 minutes, which is called delayed contrast image in short axis also. So short axis views or plane of the heart in non-contrast and delayed contrast study. What is the finding here? If you look at the myocardium of the left ventricle and the thickness in that regions, which is called septal region, and that region are normal. However, the inferior wall and posterior wall of the myocardium, it appeared thin myocardial thickness. In post-contrast delayed image after 15 minutes, the regions of which appeared thin here are appeared enhanced and showing delayed enhancement compared with the normal myocardial wall after 15 minutes, which non-enhanced. So delayed enhancement here referring to a pathology in the cardiac or myocardium, as I will discuss it in details in the next slides. So this one is called short axis 15 minutes delayed contrast, which is showing delayed enhancement of the myocardial at that region, inferior and posterior wall, part from the posterior wall. So the keywords here, delayed myocardial enhancement representing a non-viability sign. If it is present, it referring to non-viability, which meaning irreversible or myocardial infarction. Posterior and inferior wall representing, or any wall representing the site of occluded vessel. For that regions, for example, is the right coronary artery, which is supplying that wall. Non-viable meaning that patient is not suitable for surgery. It may be suitable for angioplasty, but is not suitable for surgery. So it is very important to test MRI examinations to define this suitability for the surgery or not. MRI is the best modality for detect tissue viability. So this is the delayed contrast after 15 minutes, showing a delayed enhancement of the inferior and posterior aspect of the myocardial wall in this short axis view. So the final diagnosis is an irreversible infarction here and acute myocardial infarction. Case 5. A 76-year-old man was atypical chest pain, presented with atypical chest pain. This is a frontal chest radiograph, and the patient presented with atypical chest pain, and the abnormality appearing here at the retrocardiac region, as we see the lucency here at the regions of the heart, retrocardiac, which are continued with the abdomen. So this examination is the frontal chest radiograph or chest X-ray, and shows this abnormality. Chest X-ray showing the retrocardiac abnormality, and if you find this retrocardiac abnormality, you can suspect there are abnormality in the stomach or the esophagus. So you can request for a barium swallow or meal to confirm the diagnosis. After barium meal, you can see this displacement superiorly of the part from the stomach, and this is the region of diaphragm, so it is called the hernia. And this is also confirmed as an retrocardiac pathology in CT examination, filled with oral contrast and air in the tract of GIT. So this is part from the stomach, which are sliding upward and forming this hernia. The keywords here is retrocardiac air fluid level, representing to an abnormality in the stomach or esophagus, and they need further examinations like barium study, swallow and meal, to confirm the diagnosis. The diagnosis of the hiatus hernia should be differentiate sliding or paraesophageal type, because the sliding types is usually reducible type and no need for surgery. However, the paraesophageal type, which meaning there are part from the fundus of the stomach upward in the chest, and the gastroesophageal junction is still in the abdomen, and this may need surgery because most of it are associated with obstruction and are irreducible. CT examination rule here for diagnosis of confirms the diagnosis of the retrocardiac hernia from other differential diagnosis pathology, and also to confirm there are complications like ischemia or bowel necrosis or strangulations, or any complications can be shown by CT better than other modality. So the final diagnosis of this retrocardiac opacity with air fluid level and these protrusions of the part from the stomach in the chest, referring to sliding hiatus hernia, and this retrocardiac bowel component, referring to the final diagnosis of sliding hiatus hernia. And now with the two challenging cases as usual, the case 6 to be continued in the next Wednesday. This is an MRI examination for the brain and the cervical spine. I will discuss it in details in the next presentation. This is another case, case 7 also. I will discuss it in the next Wednesday to be continued also. The first row is stress study of the cardiac SPECT by isotope, and the second row in the rest status. What is the suspected diagnosis? I will discuss it in next Wednesday. I hope this lesson has helped to make a few things clearer for you. If you have any query or comment, you can pop it in the comment box, and also you are welcome in my Facebook group by the same name, Is and Different Radiology. I discuss a lot of cases in that group daily, and you can watch more than 100 presentations in my YouTube channel by searching in the Google search Is and Different Radiology, the name of the channel. Don't forget, next Wednesday with new 5 cases, with another 2 cases for challenging next week, and also wait me every Sunday for FRCR Part 1 anatomy lesson. Thank you very much for your watching, and have a nice day.